Spiders are not very popular. Their bite can cause irritation and make your child itch, but spider bites are rarely anything you actually really need to worry about. Here to help us sort out the dangers of spider bites is Dr. Heather Edgley. She's an ER physician at East Tennessee Children's Hospital, and thank you for being here this morning. First of all, let's talk about, if your child is bit by a spider, a lot of parents might immediately kind of overreact, and what should they do?
Well, first of all, there's only 2 spiders in East Tennessee that we really worry about, and everybody knows the names of those. It's the black widow spider and the brown recluse. Lots and lots of spiders can cause a very local reaction, maybe a little redness, a little discomfort, something more like just an insect bite. You might think it's a mosquito bite or an ant bite, really don't know what it is. And those are nothing to be worried about. The black widow spider and the brown recluse, though, can do a little bit more damage. But not every time. Now, first of all, a parent probably will not know when their child has been bit by a spider. It's pretty rare that you actually see the offending insect or spider in this case.
Right.
So instead, what the parent is going to see is something that looks red, maybe painful, maybe burning, maybe a little bit itchy. And if it's rather small, it is nothing to worry about. However, when a child, especially a child or a much older person, experiences a spider bite that causes systemic or total body effects, then they need to maybe seek some medical care. And those things might be very bad muscle cramps, abdominal pain, back pain, fever, malaise, feeling bad all over, or if the bite is very, very large, very, very red, and they develop fever.
So if it's not as serious, and that's the more likely scenario, since there only are those 2 spiders that can be dangerous.
Correct.
What are some of the treatments that parents can give them just to kind of help their child, some relief from the itching?
Sure. If it's a small bite, then certainly cool or cold compresses, ice packs will help. Sometimes if there's more discomfort, maybe even a warm compress might help. Tylenol, ibuprofen, Benadryl, those things that are over at the counter will help with the itching or the discomfort as well. If it's much bigger and there's a lot more pain involved, then certainly seeking medical care, especially for a black widow spider bite, which causes these terrible muscle cramps, backache, and abdominal pain. There are other things that can be done in the emergency room, like medicines that we would give via IV, such as a muscle relaxant or a very strong pain control medicine. And in some instances, when there is a very bad reaction, then we can use an antivenom. Now, that's very rare. It's very rare that that needs to be used, but we can use an antivenom for black widow spiders. Brown recluses, on the other hand, can cause a very large necrotic area or a dead tissue area in the body. And once again, this is very rare, but it does happen occasionally. And those may require skin grafting, may require debridement, where we clean out the wound over a longer period of time. So it's really hard to tell which of those bites are going to turn into that and which are not.
Either way, just seek a doctor if necessary.
Yes.
All right. Thanks for being here this morning.
Thank you.